All right, so like she said, my name's Carly. I'm with Cigna, and I've worked with Cigna for probably 5 years doing this, and this is the first time I've ever done this topic. So it was really fun. I got to do some extra research and learn a lot about supplements, so I'll share that with you guys today. And I kind of want the take home from today to be supplements are not a bad thing, but our best choice is always going to be getting it from food, and then we'll kind of talk about the benefits or the areas where supplements can help us out a little bit more. So going through, I have a couple different questions on here. Can supplements fix a poor diet? What do you think? Okay. Can a high dose of any vitamin or mineral prevent, treat, or cure a chronic illness? Okay. And then can vitamins provide extra energy or more brain power? So all of these are no. So with vitamins and minerals, the only thing that actually gives us energy, because in reality energy equates to calories, would be proteins, carbohydrates, or fats. We do have certain minerals and certain vitamins, B vitamins for example, especially like B6 and B12, do a great job with assisting in increasing different chemicals in your body to help make you feel like you have more energy, but the only things that actually give us more energy are food sources. Couple more questions. Are plant-based products, so things such as herbs, harmless because they come from a plant? Okay, correct. No, they are not. Even a lot of our medication that we get comes from plants too, and we all know how many different side effects you see with any type of medication, right? You look at a pill bottle and they say like, here's what it helps, potential side effects, and how long is that list we typically see. Next, does emotional stress increase your nutritional needs? So having high levels of stress, does that increase your nutritional needs? Everyone's like, So actually no, it may put more strain on the body, it may cause you to do other things. Most of the time our hunger will increase, most of the time we have like lack of sleep, we get more tension, but as with our nutritional needs, those don't change. Do supplements give you immediate results? So we see a lot of this in the market today, right? We see something that says fat burner or weight loss pills. Are those immediate results? No. Okay, and I think one important thing to keep in mind is, especially when you see any type of fat burner or weight loss, that's a quick fix and it really in the long run doesn't work. And I want you guys to remember that because you'll see it over and over and over. There's always a new supplement out there that's going to give you the latest weight loss miracle, right? Those don't work. If they worked, every single person would be on it and we all would have perfect bodies. And then last question for you. If you become more physically active, do you need more nutrients? Okay, that's kind of a trick question. You may need more protein, you may need more carbohydrates, but talking more like, do you need more B vitamins? Do you need more iron? Do you need more folic acid? Things like that? No, you do not. So we're going to talk about protein needs. So that's the only really main area where you would probably, if your exercise goes up, your protein intake would need to come up. A lot of people ask me, how do I know how much protein I need? Right? You just most people don't know. So we're going to calculate that today, how you do it. And if you have a paper, if you have your phone, go ahead, pull it out. So I want you to take your weight. So think about how much you weigh or a rough estimate of how much you weigh and divide that number by 2.2. Ladies, you'll like this because we're going to use our weight in kilograms, so it's typically half. So, for example, if you weigh 100 pounds, divide it by 2.2, so you're going to be roughly 50, okay? Then you're going to think about your exercise level. If you're semi-active, not active at all, extremely active, and you'll see the recommendations on there. So you're going to take that number and times it by, if you're moderately active, 1.2. That's going to tell you how many grams of protein your body needs per day. Okay? Any questions on that? So that's a good reference. So pay attention as you're eating, you know, whether it's chicken, obviously any type of meat is gonna have a little bit higher levels of protein than some of those plant-based proteins. So anything like cottage cheese or Greek yogurt or mixing different vegetables or peanut butter, those are gonna have a little bit lower levels of protein in them. So we're going to talk then quite a bit about the supplement industry. It's obviously started booming over the past probably 15 years. We've seen a lot more different supplements come out. In the US, dietary supplements are substances that you eat or you drink. So you can take it in a pill form and swallow it. You can take it as like a mixture, mix it in with something, blend it. So different things like that. Now, keeping in mind, and like we said at the beginning of the call, supplements are not meant to replace your diet and the foods that you're eating. The goal is to get most of the nutrients you can consume for the body through the foods that you eat. Next thing on there, people commonly take them for health-related reasons, right? What are some reasons that you would need a supplement? Deficient, so what, any idea of what would cause you to be deficient? Any type of illness or anything like that?
Osteoporosis.
Yes, and we're going to talk about that today, osteoporosis. We see a lot of things, women who are trying to get pregnant, and we'll talk about this too. Folic acid is a great way to go. So, but definitely there are reasons where supplements come in handy, and there's reasons that we need them. Keeping in mind that it is not a food and it's not a drug. This includes anything when you're talking about a supplement. It's a vitamin, a mineral, an herb, an enzyme, a hormone, or an amino acid. None of these have calories to them, okay? Meaning they do not give you added energy. So dietary supplements are not intended to treat, diagnose, prevent, cure any type of illness. And you'll learn about this and we'll kind of see how they're regulated, because I think that's something important to keep in mind. How supplements are helpful for us. So we're kind of talking a lot at the beginning of this of how reach for foods, go for food. You want food as your main source of energy. But yes, vitamins and minerals can be beneficial for the body. So prenatal, postnatal, like we were talking about, a woman who's trying to get pregnant, in those first like 21 days of pregnancy or when a baby will start to form its brain, its spine, and that's where folic acid becomes very important. So preventing things like, it's called spina bifida, a problem that a child could have. So taking a folic acid or a prenatal pill is obviously very important for a female to do. Anything, if you're highly restrictive weight loss regimen, so if you're someone who's extremely overweight and you're working with the doctor and they have you cut your calories back quite a bit, you probably need a supplement to add those vitamins and minerals that your body may not be getting or hasn't been getting for quite some time. Anyone who's strictly vegetarian or someone who is vegan, sometimes a vitamin or mineral is beneficial, something like iron, because a lot of iron comes from red meats, may not be a bad way to go. Anyone who has elderly, so typically what we see with older people, and if you have older parents, you may know this, they tend to eat like 1 meal a day. They don't tend to eat very much, right? They don't like to cook, they're old, it's hard for them. So they're only eating once, maybe twice per day, so they're not getting enough nutrients in through the food, so a supplement would be beneficial. Poor dietary habits, like you mentioned, osteoporosis. We'll talk about this a little bit more, a little bit further into the presentation and give you actual recommendations on osteoporosis and what supplements you should be taking for that. Anyone with anemia, so low blood count, low iron levels, and then anyone who's lactose intolerant, right? You're gonna have a hard time absorbing like calcium and vitamin D and different vitamins along those lines. Now, here is where the caution comes in. Supplements are not regulated by the FDA, which means a company does not have to prove what they put into that supplement, okay? So if you're buying a supplement, I would highly recommend spend a little bit more money and buy a high quality pill, all right? A good rule of thumb would be once you get your supplement, sit it in water and let it sit for 30 minutes. If that supplement does not disintegrate and dissolve, then you know what, it's going to do that exact same thing in your body. You're going to put it in your body, and then you're going to excrete it when you go to the bathroom, sometimes still in that same pill form. Okay, so good rule of thumb, sit it in that water, test it. If it does dissolve, then it's going to dissolve in the body. So the manufacturer does not have to prove that the supplement is effective. A manufacturer does not have to prove what is in it. Recently, there's a company here in, Salt Lake City, and they make protein powders, and they do it as meal replacements and fill it full of vitamins and minerals. I was at their place, and I was doing a training with another guy, and I overheard the guy talking who owns the company, and he said, "Oh yeah, I didn't have enough of the protein, so I just threw this filler in." And I was like, so I kind of got talking to this other coworker, and he said, "We do it all the time. It's a lot cheaper for us to have this filler that we just stick in it versus paying for the actual high-grade protein to put into it." But again, it's not illegal because it's not regulated. There's no rules that say you have, because you said there's 15 grams of protein, you have to prove that you put 15 grams of protein. So take the time, research out good supplements, good companies to go through. A lot of times a third-party company, meaning they come in, they test this product, and they give it a stamp saying, yep, everything they say that's in it is actually in it and in those doses. So take supplements with care. Excessive amounts obviously have undesirable side effects. Okay, many cases we can feel like, oh, it's a lot easier to take a pill than to try to eat a salad every single day, right? That's easier. But keeping in mind, when you read that ingredient label, and if it says 500% of your vitamin A, or 150% of your vitamin E, that's in excess to what your body needs. And anytime we have too much of something, it's not necessarily a good thing. So we're going to talk in a minute about how certain vitamins and minerals can decrease the absorption of other ones, or how there can be negative side effects by consuming some vitamins and minerals in excess. A couple of things to pay attention to. So for example, vitamin K reduces the ability of the blood to thin. So look at those food labels, and look at your supplement label. Make sure that you're not getting excess levels of vitamin K, because it will have negative side effects on your body's ability to thin its own blood out, which means the blood's more likely to clot. As the blood clots through the body, it can get lodged in one place, and then that's where we see strokes happen, or that's where we get those blood clots. Vitamin C and E, they reduce the effectiveness of certain types of cancers and chemotherapies. So again, keeping that in mind. And then we also see different things. Fat-soluble vitamins, so A, D, E, and K, can build up in the body and become toxic. So we have fat-soluble and water-soluble. Fat-soluble vitamins, obviously they need fat, they bind with fat in order to work. So if you have a high excess of it in your body, it's going to build up onto that fat and cause it to bulk. So a couple things. Don't believe everything that you read on these supplement pills. Oops. Health claims. So we have a few different claims they'll make. Health claims are where they describe there's a link between nutrition and health, right? So example on there, calcium reduces your risk for osteoporosis. Nutrient content, meaning one capsule contains 600 milligrams of calcium. One example for this is with calcium, there's different forms of calcium. You'll see calcium citrate, carbonate, there's multiple different names for it. Depending on the type of actual calcium that it is going to have a different absorption level. So even though it may claim it has 600 milligrams of calcium, maybe the calcium carbonate is your body's only going to digest about 200 of those milligrams, while a calcium citrate is going to absorb maybe 500 of those milligrams. And then last, the structure or function, so it's going to explain what it actually does. So it will say something, fiber helps regulate bowel regularity. Now, in order for a supplement to say a function claim, it has to be proven. So for like fiber, every time you eat fiber, it is going to help with regularity in your bowel movements, right? That's a claim that's provable. So, talking about the structure, One thing that I thought was very interesting too as I was researching this, I went and looked at recent studies done, and I read this study, and it comes from the Department of Health and Human Services. They, last year in 2014, examined 127 different weight loss supplements, and 20% of those carried illegal claims to help cure or treat disease. 20%, like that's a pretty big amount. Meaning they said that they did things that they really don't do, or they claim that they did things that they have actual no proof that it does. So I want to show you a little clip from WebMD. What we're going to do is we're going to go through and talk about a few different types of supplements and what they do and whether or not they're beneficial to take. So we're going to talk a little bit fish oil. How many people have ever either taken a fish oil supplement or been recommended to take one? A lot of people have. A lot of doctors will tell you to take a fish supplement. My take is, if you're going to take one supplement and you're a healthy individual, this would be the one to take. Okay, it does a lot with working on brain functions. It helps to prevent dementia, memory loss. Now, we can get it from foods and we can get it from a supplement. So I want to show you this slide. It comes from WebMD. It gives you recommendations on actual food to use in place of a supplement. Take just a second to pop up. Maybe. Do I have to slide it? Okay. This is why I present, I don't do IT. So a few different types of foods. We have walnuts, and I would write these down and find ways to incorporate them into your diet on a regular basis. If you have walnuts, enhanced eggs, meaning eggs that will stay on it, high level of omega-3 fatty acids, or a good source of omega-6s. Okay, they've been enhanced so they have a higher level of that DHA. Next thing, fish, and finding ways to cook with fish too. Salmon's a great choice, halibut, any type of fish. Obviously, fresher the better, right? Beans, most of the time they'll say pinto or kidney beans are going to be your best source, but even like along the lines of black beans, refried beans are still good choices to go with. Fortified milk or dairy, so same thing with that we talked about with the eggs, looking at the actual box or container of milk and making sure it says DHA or EPA or omega-3 fatty acids, something like that, to see that term, and that's telling you they're adding those healthy omegas into the food. So olive oil, right? Extra virgin olive oil, great one to cook with if you're going to use oil. Again, is it more expensive? Yes. But when you really weigh things down, I think it's worth it to spend an extra $5 or $10 to really improve your health or to get something that's actually benefiting you versus going for the cheaper brand that really isn't doing anything for the body. Kale, spinach, leafy greens. So with this, it was funny, I was coaching a guy yesterday and he's like, I don't eat vegetables, they're gross. He's like, I can't eat vegetables. And so we talked about finding ways to add more like veggies into your food, and we talked about spinach and kale specifically, but easy way, make a smoothie in the morning, throw your spinach into it, blend it. It will change the color of the smoothie, but you will not taste it at all. Or puree it and throw it into like whatever you do for dinner. If you do a casserole, if you do like any type of sauce like spaghetti, puree some of those veggies and just throw it right into your mix, and that way you get those foods in, but you don't have to taste them. I told him I felt like I was dealing with a 5-year-old kid. Seaweed. So this one, I know you hear it and you're like, ew, gross. But what about sushi, right? Make sushi, that way you can use the seaweed for it and you can use the fish and double up on those omegas. Flaxseed and other types of seeds, chia seeds. Does anyone use those? Yeah, a couple of you. How do you use them? Smoothies. Yeah, if anyone eats oatmeal, throw a scoop in there, mix it up. Again, you're not tasting it. It sounds kind of weird. I like to drink chia seeds. I just mix like water with like a scoop of chia seeds and some type of like flavored water, like a tea packet or Mio or something like that. You can still taste the seed, but I like that taste. But that way I'm getting my healthy fats in for the day and I'm just drinking them. Tofoods, edamame, any type of bread, cereal, or grain, it would have to be enriched with it, or it would have to say that it has like the flaxseed to it. And then your last one on there would be then turning to your supplement. Now it's a matter of getting back to where we were. Okay. Oh, sorry, I'll have to skim through these. Okay, next talking a little bit about folic acid. So like I mentioned at the beginning, very beneficial for a woman who is preparing to get pregnant. What we see with this, there's multiple clinical trials that have shown folic acid supplements cannot lower the risk of heart disease. There's been a lot of talk that it helps lower the effect of it. A lot of people will say that. A lot of claims will be made on products saying, hey, this is a great thing to take to help lower your risk of heart disease. There is no study out there that has shown a direct correlation between higher levels of folic acid and decreased risk of heart disease. Okay? Also keeping in mind that too much of it or toxicity can become harmful to the body. Other things we see on there, B vitamins, so may help with lowering blood pressure, but again, with lowering your risk of heart disease, but no studies can actually prove that. What does work for lowering your risk of heart disease? Fiber supplement may be beneficial. Things you can even take like scoops of it. I know they have like Metamucil and different things like that are higher levels of fiber. Reason fiber works is because fiber is plant energy. So fiber to plants are what a carbohydrate, a piece of wheat bread, does to our body. It raises that blood sugar, our body utilizes it as energy. As we eat fiber, our body goes, I don't know what this is, I don't know how to digest it, so it excretes it. But think about the foods that have fiber. They're healthy foods, right? So they offer a lot of vitamins and minerals. So you eat that fiber, your body grabs all those nutrients from it, and then it excretes the fiber out of your body, causing you to go to the bathroom more, therefore excreting harmful stuff out of your body. And that's why they say taking a fiber supplement of some form is helpful. Also, anything, if you're not going with a fiber supplement, sources of fiber are what? Do you guys know what foods that have fiber in them? Nuts. So things like oatmeal, brown rice, any type of vegetable, especially if it has the skin on, or even some fruits with the skin, are a great way to go. But that would probably be your main sources. Fiber, you could do things enhanced, like you'll see again, kind of like we saw at the previous slides, but doing things that will say like enhanced with fiber or it has added fiber to it. But typically that's going to be like wheat bread, brown rice, quinoa, oatmeal, and then your fruits and veggies. So we hear a lot of claims on these three topics up on the screen. With them, nothing, again, has ever been proven to say it actually works. So you hear things like, oh, garlic can help lower your blood pressure. Garlic can help lower your cholesterol. That's not necessarily true, so don't waste your money buying those types of products. Okay, potassium. This is something that has been proven to help lower your risk of cholesterol, of high cholesterol. What foods have potassium? Banana, that's what everyone always says, right? That's just what we know. When in reality, there's a lot of foods that have higher levels of potassium than a banana. Sweet potato, tomato paste, green beans, white beans, yogurt, fish, soybeans, tofu, and then you see bananas. Okay, so a banana is a quick and easy way to go, but I would encourage you guys, find some of these other foods and add those to your diet on a regular basis, because that potassium will show with, and even if, I guess if you even research how they do open heart surgeries, a lot of times what they do is they lower and take out all the potassium in your body, and that stops the heart from beating, and then they perform their heart surgery and they'll increase those levels of potassium and then work to start your heart rate again. So finding foods high in potassium, great way to go. Lowering blood pressure. So if you have high blood pressure, watch out for these 5 things up on the screen. All of these have been shown to actually have the adverse effect. They will increase your blood pressure. And even nowadays too, I see a lot of stuff with ginseng. I know they have like little ginseng candies or gummies. They have a lot of drinks even at like Sprouts and Harmon's, stores like health stores. They do a lot with like drinks that have ginseng in them that are supposed to be pretty healthy. Keep in mind, if you have high blood pressure, you probably want to avoid having drinks with ginseng. Cinnamon, on the other hand, is a great way to help lower blood pressure, and there are studies that are done that have shown that it does help to decrease triglycerides, decrease the LDL, which is that bad cholesterol, and help decrease your risk of type 2 diabetes. So easy ways, how can you add more cinnamon into your diet? You can add it in almost anything. I'm like a huge fan yogurt, and I throw a teaspoon of cinnamon in, mix it, it's so good. Vanilla yogurt with cinnamon. I add it into oatmeal. If you're cooking any type of like really dessert, any type of like cookie or pastry or dessert type of food, hey, it might not be a super healthy, throw some cinnamon into it and get a little bit of a health benefit from it. You can put it like apples. I will put cinnamon on my apples. You can add it into water and do like a flavored water type of thing. So lots of different ways. Recommendation, they say, is just a teaspoon of cinnamon every single day. Now, does taking vitamin C help prevent the common cold? You start to get sick and you're like, where's those vitamin C packets? The emergencies, right? Okay, so the answer to this is no, it actually doesn't. And I have a video for you from WebMD that goes into a little bit of detail.
Myth or fact? I caught a cold because my immune system was weak.
No truth in that. You don't catch a cold because your immune system is weakened. However, if you keep a strong, healthy immune system through healthy activities such as exercise, regular exercise, and a healthy diet, then you may actually get well quicker once you do have a cold.
Myth or fact? Vitamin C and zinc prevent colds.
That's false. There is no evidence that vitamin C, zinc, another popular one is echinacea, does anything to help prevent a cold. However, once you have a cold, vitamin C at a high dose, zinc or echinacea may shorten the duration of your cold.
Myth or fact? Eating dairy will increase the mucus of a cold.
That's a big myth. Absolutely not true. Nothing you eat is going to cause more mucus. Now, not drinking water could increase your mucus. You become dehydrated, your mucus or your snot gets thicker, more congested, but dairy, nothing to it.
Myth or fact? Chicken soup helps fight colds.
True. Chicken soup isn't going to cure a cold, but it will ease your cold symptoms. Your grandma was right. It helps with congestion. The heat will help soothe the sore throat. It's really great for a cold. So is gargling with salt water, hot tea. Anything warm is going to make your throat feel better and possibly help with congestion as well.
Myth or fact? Antibiotics cure colds.
No, they don't. Antibiotics have no effect on a cold because a cold is caused by a virus, not a bacteria. Antibiotics only work against bacteria. So you may think that it shortens the duration of your cold, but likely what is happening if you have a cold is that you're already starting to recover once you start that antibiotic.
Okay, so I liked that video because I think it clears up some of the myths that we sometimes hear and some of the things that we think. You know, I don't know how many times people have said to me, sorry, it's gonna always start this from the beginning. Maybe here. I don't know how many times people have said though, oh, I'm starting to get sick, like grab that emergency packet. And so I think keeping that in mind, that doesn't stop you from getting the cold. Like you said in the video, it can decrease how long you're sick for, but it's not gonna prevent the common cold. So foods, we're gonna kind of move on talking a little bit about antioxidants and cancer-fighting property foods. There aren't very many, I guess, vitamins or minerals out there that help with decreasing your risk of developing cancer, but obviously the more antioxidants or more phytochemicals you eat, there's certain foods out there that are proven to turn off that cancer-fighting gene or decrease your likelihood of developing cancer. So there's some up on the screen. One thing I think is so interesting is tomatoes cooked are one of the best foods you can eat to help prevent the likelihood of developing cancer. For some reason, when they cook a tomato, there's a chemical reaction that occurs and it ignites the lycopene and causes it to have cancer-fighting properties. So berries are another really good one, and then deeper the color, so darker the purple, darker the green, darker the orange of any type of veggie, the healthier it is for the body. So again, as we've talked about different foods, reaching for any of these types of foods on a regular basis are going to be very beneficial for the body. So other things that may help reduce your risk of colon cancer, which colon cancer is the second leading cause of killing cancers in the United States today. So obviously a very important and a really big cancer that we see in the United States. Calcium, so any type of supplement or dairy can decrease your likelihood of developing colon cancer. Vitamin D is another really good one to do in conjunction with your calcium. So your body, it shows that if you have calcium and vitamin D, your body will absorb that calcium a little bit better. That vitamin D kind of binds to it and increases that absorption versus just taking calcium or just having vitamin D. Good thing is a lot of those foods go hand in hand. A lot of foods that have calcium also have vitamin D. So we're going to talk about, as you mentioned at the beginning, osteoporosis. So working on bone, the kind of trifecta we call it, vitamin D, magnesium, and calcium. Those three supplements together are what really work to give yourself good bone health. Now, osteoporosis just doesn't happen to women. It happens to men too, and even getting brittle bones is something that we see happen for multiple people all over the United States and really all over the world. They've just started doing a bunch of research too, which I found super fascinating, and it's on, basically they look at people as we age, and you know how a lot of times what happens is someone breaks their hip or you break your ankle because you have brittle bones. They're now studying it and saying, okay, is that bone breaking and then you're falling? Or is it you're falling and then that hip bone's breaking? Because you have the osteoporosis, you have that brittle bone, you may step weird, break your hip and fall. And I thought that was a really interesting point, that maybe that break is happening and then causing the fall, all because our bones aren't strong enough. So they talk about making a combination of the three different things of your vitamin D, your calcium, and your magnesium to really give yourself bone strength and bone health. Obviously, we want to start doing this as young as possible because our bones stop growing, our bones stop kind of developing at a young age. Typically, it's around the ages of 18, 20, maybe 22, your bones will stop growing. So getting it in as young as possible. So if you guys have children, incorporating it into their diets. The recommendations, so talking about calcium, and I kind of said this at the beginning, but calcium citrate is going to be the best form of calcium if you take a supplement. You'll see probably 5 or 6 different names for calcium, and they have all different forms of calcium. Citrate is typically the most absorbable form. The other recommendation they give is taking it in smaller doses, your body will absorb it better. So for example, you'll see like after age 50, they say 1200 milligrams. Break it up and take it a couple times throughout the day versus taking it all at once. Your body will absorb in small amounts better. It also will absorb better if you eat it with food than on an empty stomach. And then also it will absorb better, again, like we said, if you have that vitamin D or even that magnesium along with it. Now you can get that through food and do like a calcium supplement and then eat some type of food that has magnesium or vitamin D to it, or you can take that supplement with it. Either one of those is going to absorb better into the body. Glucosamine, this is another really popular one, and it's interesting because there's not any study that says taking glucosamine will help with joint health or inflammation or strengthen the joints or lessen the pain that you have in your knees or your hip, but people swear by it. So they don't know if it just the research hasn't been found, if it's just something that's in the mind, you know, kind of like that placebo effect. But there's millions of cases where people say they see a significant difference. They have pain relief from taking glucosamine versus not taking it. But fish oil, so we talked about that at the beginning. It's also shown to help with like joint pain. And then you'll see the SAMI. Studies are kind of hit and miss on this too. They have some studies that support it, some studies that go absolutely against it and say that it does no benefit. But people are reporting they feel relief with like arthritis, with lupus, different things like that, the joint pain. So multivitamins, here's a couple of tips. I put a couple pictures up there. If you buy a supplement, these will be the brands that I would recommend. Watching out, making sure 100% of your RDA or less. You don't, unless your doctor tells you, you do not need something that's going to be 500 or 800% of that recommendation. Avoid products that have higher than 100% of your vitamin A and your vitamin D. They have toxicities that are going to then turn around and hurt the body. For example, taking high levels of vitamin A can counteract the absorption of iron. So then you're going to start losing iron from the body because your vitamin A level is so high. Watching Good Choices, so I put those up there. Those are brands that I would recommend. They're either third-party tested or there's been a lot of research done on these companies, and they're very well known and they have reputable reputations. So our essential vitamins and minerals. We have A, D, E, B1, B2, B3, B6, 12, C, and folic acid. What that means, essential, that means our bodies do not make these vitamins and minerals, so we have to get them from the diet. A lot of the other ones our body can produce, meaning they're non-essential, so if you're lacking it, the body has the ability to make it and make up for it. These vitamins the body does not make, so therefore we have to get it from the foods we eat or the supplements we take. So going through who needs the supplements then, and this is more in relation to iron. Like we said at the beginning, so someone who is underweight may need an iron pill, someone who is vegetarian, Crohn's disease, because the stomach has a lot of digestive issues that you tend to excrete more calcium, or foods that are high in calcium, the body has a hard time digesting. Any adolescent girl, pregnant woman, men typically consume plenty of iron. Iron we find in a lot of red meats, we find in a lot of like beans, green leafy veggies, so those types of foods, and men typically eat plenty of that, and so they do okay without needing iron. What's happening, and the reason why people would need an iron supplement, is the red blood cells start to shrink, and then they're getting less oxygen, and then the body starts to basically, you get tired, you have poor memory, you have a weak immune system, your body's not using the cells like they're supposed to, so that blood and that oxygen's excreting from them, and then you're feeling that fatigue. So foods high in iron, Orange juice too, strawberries, broccoli, and I think it's interesting because as I say these, a lot of them are on repeat, right? There's a lot of really common foods that have so many health benefits for us. Those are the foods you want to make sure you're eating on a consistent basis. There's a recommendation on there, so depending on your age and depending on your gender, how many milligrams of iron the body needs each day. So I wanted to take you to this website, and I will probably email it to you guys. You can get online and find a lot of helpful tools nowadays, and this site goes through and it's going to tell you, so I put in all of my information, and what you'll do is you'll put in your gender, your age, your height, your weight, your activity level, and then you tell it to calculate it. And it's going to give you your recommendations of every single thing that you will need. So it's going to go through and it's going to say, here's all my information. And then it's going to go through and say what you need on everything. You can click different things. And it's going to go through and give my recommendations on proteins. And it'll pull up a chart here and say, here's everything that you need for fruits. Here's your vegetables. Here's your proteins. It's going to go through and give you a BMI, which is going to give you your height. And this is something I would recommend everyone does. Oops. And it's going to do a calculation and tell you where you're at. Now, recommendation here. They say weight versus your height. You want to be somewhere between 18 and 25 typically. Anything above that 25 is going to mean you're at a greater risk for developing any type of health complication. Okay, so you want to go through, figure out where you're at. You can kind of see it on there. Doesn't mean that you're necessarily going to develop a health complication, but it means you're at a greater risk. Okay? Go back and forth. It'll also go through and give you all of the guidelines for how many supplements you need and in what, what recommendation it has for every type of vitamin and mineral out there, and the dose that you need. So I'll send that out to you because it's kind of a good site to play with and learn. And then one last tip, when you are out shopping for supplements, these are all third-party tested signs that you want to find on that supplement. So if you see any of these 3 signs, it means another company has come in, looked at that product and said, yep, everything they say that's in it is really in it in that amount. Or, yep, the claim that they put on there is a real claim, and they have research that backs it up. So it may cost a little bit more money to buy these supplements, but in the long run, again, it's a lot better that you invest a little bit more money in a better quality supplement than you buy something that is doing absolutely no good for your body. Other tips, check out the expiration dates. Make sure you're not taking anything that's expired. And then also make sure you're storing them in a cool place so that you're not ruining because chemical actions will occur at either high temperatures or cold temperatures that are going to counteract each other and make it so when you take it, it's not going to do the job that it's supposed to in your body. So that's everything for today. Hopefully you've learned something. Hopefully you have a good take home. Focus on the foods that you're eating. Do the best you can with your nutrition. And then if you're falling short, you can consider the supplements. So that is everything. And hopefully you have a great rest of your day.
So you guys be sure to fill out the evaluations and